Hello and welcome to the second in a series of dental negligence vlogs from the clinical negligence team at Number 5 Chambers. These vlogs are aimed at dental negligence lawyers and provide an invaluable insight from experts as to how lawyers can improve their chances of success in dental negligence claims and also improve their efficiency in running these claims, thus reducing their costs. This vlog follows on from the first in the series, in which we discuss the topic of which expert to instruct in a dental negligence claim. My name is Louisa Sherlock and I'm going to be your host for today's vlog. I'm a barrister at Number 5 Chambers and I'm part of the clinical negligence team. I was a dental surgeon for over a decade before becoming a barrister. I'm joined by Mr. Richard Adams, who is a very experienced senior junior clinical negligence barrister at Number 5 Chambers. I'm also joined by two experts. Firstly, Dr. Mike Young, who was a dentist and dental practice owner for over 25 years, a dental expert for over 20 years, and author of two books. Firstly, the prize-winning Managing a Dental Practice the Genghis Khan Way, and secondly, the Effective and Efficient Clinical Negligence Expert Witness. Secondly, Dr. Lucy Nichols qualified as a dental surgeon 20 years ago. She is a member of the Royal College of Surgeons and has been doing expert witness work for 6 years. She currently completes around 200 reports a year for law firms, dental indemnifiers, and the General Dental Council. Starting then with what the expert needs from the lawyer when preparing their report. Lucy, please can you explain what exactly you need from the lawyer in order to draft your report?
Well, first of all, I need to have clear instructions. Luckily, I usually don't have an issue with that. What tends to be more of an issue can be the records bundle. Getting a records bundle together can be quite complicated because dental software systems often have different tabs where different parts of the notes are stored. So you have one tab where you have the main body of the notes, but you may have a different tab in the notes where the medical history is recorded. You may have an admin tab where admin notes are recorded, a tab where correspondence is recorded, and a tab specifically for gum chartings, what we call periodontal chartings, which would include the basic BPE or basic periodontal exam, which is the brief gum screening routine examinations, and also the full 6-point periodontal pocket charting for patients with periodontal disease as well. So when the records are requested, it's really important that the lawyer requests all the records and makes it really clear to the practice that they need everything from all the tabs in the software to make sure that all that information is included. Because it's not unusual for me to find, for example, I'm doing a case where there's criticism of the diagnosis or management of periodontal disease, and the records that I'm given may say in the body of the notes that a BPE has been taken, but the BPE isn't actually there. So then I don't know whether that's part of a template and it was never taken, or whether it does exist, but it's in a separate part of the notes that hasn't been copied across. The other thing that tends to be an issue is X-rays. X-rays can come in various formats. Some of the older X-rays are still film X-rays, and I'll get the originals, and they may be digital ones, but sometimes I only receive a really poor quality printed photocopy that's useless, that's not of diagnostic quality and not something that I can comment on. Sometimes X-rays are undated. And sometimes the X-rays that I need just aren't there at all. So it's really important to have all of the bits of the records there with nothing missing.
And you mentioned templates for BPEs. Can you explain what you mean by that?
Well, templates are something that we see in use in notes a lot these days, and they can be quite extensive. So that you can find a routine checkup can have notes that run to 2 pages of A4 due to extensive use of templates, which can actually be quite unhelpful. Sometimes those templates are filled in incorrectly or haven't been used. They have default entries that aren't relevant to the case, so that can be confusing. But specifically with regard to BPEs, sometimes they are included in the template, and sometimes they may be included with a default entry that may not be accurate because it hasn't been updated.
I see. So you say that the solicitors need to ask for the records, but other things that may be kept in separate documents, for example, periodontal charting, BPEs, and so on.
Yes.
And making sure that X-rays are dated and clear.
Absolutely, yes.
If you don't have that, then what sort of difficulties can arise?
So sometimes it will be obvious to me at the outset that there's information missing, and then I can go back to the lawyer and request the extra information, and it can cause delays. Sometimes when I request the extra information, it doesn't come back to me till several weeks later, sometimes even several months later. So obviously that's going to delay the process of the case. There are times when I may not realize that something I need is missing, such as a BPE score or an X-ray, until I'm well into the case. And if I've already spent some hours on the case and I'm very involved in the case, and then I have to stop because I'm not really able to complete the case, and then I don't get the information I need till several weeks later, it's going to take me quite a bit of time to get back into the case and work out where I was and where my thought process was at, so that I'm able to proceed again.
And does that sometimes result in extra costs for the solicitors if they are charging you or paying you by the hour?
Yes, it is likely to, because it's going to take me extra time if I have to go back to the case a second time, because as I say, I have to refresh myself on the case and get back to where I was, and that will take some time.
Yes, I can understand that. Mike, what has your experience been over the years?
Well, I must say my experience dates from the paper records. It goes right back to there. And I think one of the problems I used to find was solicitors, they'd list all the things that they sent, in their letter, and some of the items might have been missing, or the records had been so poorly photocopied that they were useless. Punch holes through writing, that sort of thing. The same problem with X-rays as well, just the quality of them. But I think really, instead of relying on the solicitors to know what the expert needs, if I was still working, I think I'd be sending a list of what I need for a case to the solicitors, like a checklist, so they know. I don't know whether you do that, Lucy, or not, but it's something I think I would do.
I don't find that's something I do. I mean, normally I do find that the lawyers know what's needed,
Right. Yeah.
and they will send everything that is available to them at the time and that they've been provided with.
Yeah.
And it may not be their fault that there are omissions, because as I say, sometimes I don't realize until I'm well into working into the case that there's an X-ray missing. So I wouldn't be able to criticize them for not sending X-rays in those circumstances. One thing that they should be aware of is, for example, if they send X-rays that are undated, that should be obvious, or X-rays clearly a poor image quality that's not going to be of any use. And those kinds of things should be fairly obvious to the solicitor and should be fairly easy to remedy before the instructions are sent out.
And do you have similar difficulties with defence work, or is this typically more straightforward in terms of getting the information that you need?
I wouldn't say there's a particular difference there with regard to who instructs me. So that can come from either side, really, those kinds of issues.
I see. Richard, what would be your take on what you've heard the experts say?
Well, I think there are two important matters really to take away from what Mike and Lucy have said. The first is that managing costs in the current climate is particularly important. So anything that means that the process as a whole is more efficient is obviously a very good idea. Obviously, it saves Lucy the extra hour or so of reading time back in when the information is finally provided. But also, perhaps more importantly, from the lawyer's perspective, it means that there's less likely to be any more fat on the bill that can be shaved off come the detailed assessment proceedings at the end. The second point, of course, is that if everything is provided as it should be at the outset, it means that the client is likely to receive a better service, because it means that the client is likely to receive the expert's report more swiftly than might otherwise be the case. So those are the two things I think that are really, really important to take away from what Mike and Lucy have said.
Yeah. Lucy, you said that. You said that the solicitors, on the whole, tend to know what is needed. But is that the case with every solicitor you deal with, or do you find that some of them perhaps have to be guided a bit?
I wouldn't say they have to be guided. No.
Okay. No.
No, I usually find that they have a good grasp. But I think, I don't know whether it's fair to say this, but I do think perhaps sometimes there's a little bit of laziness about sending something across with undated x-rays and poor quality x-rays.
Yeah.
And without checking that all the PPE scores are there. They kind of maybe sometimes think, right, I'm really busy, let's just get this sent off and hope for the best. Maybe it's not all quite right there, but maybe she'll manage. So that potentially could be the issue on occasion. I don't know. There is another issue actually I wanted to raise that I am finding can be problematic and certainly adds to my time. I get almost all of my bundles now electronically, and that's really changed over the last few years. I was getting a lot of hard copies even up to 3 years ago, but now pretty much 100% electronic bundles. But the way the electronic bundles are presented can vary quite a bit. So sometimes I download a folder which has 30 or more subfolders and documents, and they may be labeled in a way that doesn't allow me to see what's in that until I click into it. And so if I'm, and it may be a case where the patient has been to several different practices, and if I'm trying to navigate my way to a bit of the notes, or I need to look at something, it's hard to know which folder it's in because I can't instantly see that. I have to open up lots of folders and try and find it. And I get, in some cases, so much information, but it seems to be in a really quite a disorganized, random format. And it compared to a hard copy bundle where you can flick through the pages, it's actually much more time consuming to find the bit that you need. And sometimes I'll even find pages of notes that have been scanned in as individual documents. So every page of the notes is an individual document that I need to click into and open just for one page, and then I need to shut that and click in and open the next, rather than being run together and just scrolling through them. So that can be difficult as well.
So what advice would you give to the solicitors when they're presenting you with electronic documents or electronic bundle? Is there anything they could do to assist you?
Well, I have to say that probably the best electronic bundles I get are from the GDC. The bundle is all one document. So it might be, 200, 300 pages, but it's got a really good index at the front. So I know exactly which page to go to for which section of notes, or the radiographs from a particular practice. That's all on the front page. And I can scroll straight to it. And the radiographs are always there they're always there, they're always dated, and they're always a really good quality image that I can use. So actually the GDC bundles are very good in that respect and very easy to work from.
So that's all in one document, you say, and then is it tabbed so that you can really easily get to the documents that you want?
No, it's not tabbed, but I just find that because I've got the detailed index on the front page, I can just look up. So say if there's more than one practice, if I want to check the notes from a particular practice or the x-rays from a particular practice, I just look at the front page and I can see which page of the document it is, and I just scroll through straight to that page, and the thing that I need is right there.
So it sounds what might be helpful would be then having the index page and then having all of the documents paginated, and then you can then more easily scroll through it and get to where you want, rather than having to open lots of different documents, which is going to take you, as you've explained, a lot more time.
Yes, I mean, exactly. So when I have 30 subfolders and some of them might just contain a single form or like 3 lab dockets or something, which are really of no relevance. And I have to keep opening all of these folders with rubbish in that I don't really need to look at. And sometimes I tell myself that when I've seen that it's nothing I need and closed it again, I should rename the folder so I don't have to keep opening it later next time I'm working on the case, trying to find something that I need. So it's a bit easier to see, but I never really get around to that. But I have all these folders with these unhelpful names that I can't really tell what's in them until I open them up.
I see. So it sounds like the main points then are making sure that all the documents are there, including the BPE, which, if anyone doesn't know, that stands for the basic periodontal examination charting that dentists do to assess gum disease that should be done at each appointment. Make sure that the x-rays are properly dated and that they're of good quality. And looking at electronic bundles, making sure that there's an index, if possible, have it in one document, not lots of separate documents, which is going to take you more time to go through. Would you say that they're the sort of main takeaway points?
Yes, yeah.
I think so. Yeah. And it would make the whole process much more efficient and cost effective.
Yes. And Richard, what did you think about Mike's suggestion about perhaps if the expert is told this is going to be a case, I'm going to ask you to advise on periodontal disease, for example, undiagnosed periodontal disease, what will you need? And then the expert comes back and says, well, I think this is what I'm going to need. And then the solicitor goes away and asks for that. Do you think that's a good way to?
Yeah, absolutely. I think obviously you have to tailor the approach to the seniority of the fee earner involved. There's no point in telling grandma how to suck eggs. But certainly, especially in perhaps a more complicated case, or if there's a particular aspect that's going to require pretty careful scrutiny, then I would have thought it would be very handy to have a checklist of essential documents that the expert can forewarn the solicitor is going to be required.
Yes, I think that's good to know that if solicitor is just not entirely sure about what might be relevant or what might be important, do you ask the expert in advance before getting the records, and then hopefully you can then get everything that you need, and it saves a lot of back and forth down the line.
Less experienced solicitors, if they're not sure what we need, they should just ask.
Yes, yeah. It's all about communication, which I think is the subject of another vlog.
Yes, we'll be coming to that next. Great. Well, thank you so much to Lucy, Mike and Richard for your comments and insights. It's been really interesting to find out more about what the expert needs from the lawyer when drafting their expert report and how lawyers can improve their cases and reduce their costs in that regard. It only remains for me to say thank you very much to everyone for joining us for this vlog, and I hope to see you all in the next one. Goodbye from all of us for now.
Thank you. Goodbye.
Goodbye.